Well, good afternoon, everyone. Thank you for joining us today. Before we get started, I want to welcome everyone. If you're returning, and this is our seventh um, presentation this year, we have a great guest today, and we are partnering with Johns Hopkins Geriatric Workforce Enhancement Program. So we have professional development, community education, monthly lunch and learns. Ask the dementia expert to help with this ongoing crisis. And we have with us aging service professionals, caregivers of persons with ADRD, and anyone with really an interest in matters concerning older adults. I'm going to turn this over to Jane Marks, who is the Associate Director of Johns Hopkins Geriatric Workforce Enhancement Program. She's a nurse with the Division of Geriatric Medicine and Gerontology, and she is going to introduce our guest today. And let me see one more thing. Make sure everyone is muted. You haven't. We have a variety of resources on our website. This webinar is being recorded and will be housed there. We have options for a variety of virtual statewide workshops if you haven't checked us out with for caregiving programs and dementia resources. The link is on this slide deck, which will be posted on the website. We're also in the Find Help website for a variety of services and supports for programming at MAC as well as the Center of Excellence. And we do also do 88 screeners on that website. The next speaking topic we have is going to be on August the 21st, so mark your calendars. We will be sending out some invitations to that for managing urinary incontinence and bowel elimination. And I am going to turn this over to Jane Marks now. Thank you very much.
Well, welcome everyone on this nice summer day. Those of you in Baltimore, which I think most of you are, before it gets too hot tomorrow, I understand. We're excited to present today supporting caregivers, and our focus today is going to be on challenging behaviors. And we are lucky enough to have Kevin Grunden here with us. Kevin is a speech language pathologist who has worked with our GWEP as well as other GWEPs in Virginia, as well as Rhode Island. We just completed a big program that Kevin was very involved with. So we appreciate his expertise. He does participate in the PACE program in Charlottesville, as well as he is adjunct faculty to Virginia Commonwealth University, and brings with him experience and interest, I think, in working with patients with dementia and challenging behaviors. So we're going to start, Kevin. We're going to have our first question, and that is, Wendy will pull up the next slide. So what are common behaviors that are challenging when caring for someone with dementia? What are some things that you've seen, and I know I've seen in these persons, and we'll go from there.
Okay, well, thank you for having me. I appreciate the opportunity. If you click the next slide, I have some behaviors put out here. These are things that nobody ever really refers to behaviors that are positive. We only talk about the negative behaviors. So when somebody's really pleasant and smiley, that's not something that we tend to worry too much about. But there are things that really kind of, for lack of a better way of describing it, like interrupt the flow of a day. We all have things that we need to get done. If I think about from a work standpoint, there's a lot of things that need to happen at home, even though you still have to be able, as a caregiver, you have to have time for cooking and cleaning and groceries and bills, and maybe you get a little time to relax. So some of the things that you find, some of the bigger ones, like the bottom list here, is wandering. We can see a lot of wandering due to the kind of not being able to navigate properly, not remembering exactly how the house is laid out. Sometimes wandering turns into exit seeking, which can be risky because someone might wander off and they're in danger. But sometimes wandering, although we call it a kind of a behavior, a negative behavior, it's sort of benign as long as the environment is set up properly. So we at work here at Pace and facilities that I work with also, we encourage wandering. We'll set up sort of a Montessori style of activities here and there throughout the building, and encourage people to walk and use some of that energy. But other things that we really run into a problem with are like this first, they don't really do what they're supposed to do. Every day we need to get a shower, every day we need to dress, we have medications, we have all these things. And so some of the biggest problems are we can't achieve that. Hygiene, bathroom, that is one of the biggest areas, and understandably so. Occasionally at my house, there's a cat in the bathroom, but other than that, the bathroom is a one-person place. And so when you are trying to help someone that's living with dementia try to get in and go to the bathroom or get a shower proper, there's a lot of resistance, even just for the fact that, hey, I do this on my own, or not really having the insight into what's going on in your daily life. Maybe there is some, hygiene issue that they're not recognizing. So anyway, that's something that we can see. Not engaging in things is a difficult one. People say, well, they don't ever do anything. And there's ways around that, what I'll talk about later, but I think that is a big topic to focus on, because without having a meaningful engagement, we do have all these other things happen. So if you imagine yourself sitting around the house like on a Saturday and you're not doing anything, you get a little antsy, and maybe you're not really interested in TV, but it's raining outside and you can't go out to the garden. And so you start getting a little, even though low level, it's still a little bit of agitation. So these things that I can no longer complete because it's too complicated for me, then makes me kind of upset, and that leads to some behaviors. Again, back with the ADLs, eating is an issue, and there are ways around that, not around eating, but ways of setting up the environment to allow someone to focus and be able to eat more independently. We all want to be as independent as we possibly can. And then finally, when these behaviors get really, dangerous, and if there's physical aggression, we'll talk again later, and I'm going to give you the answer to one of the questions, but unmet needs. So people aren't generally aggressive or physically aggressive or threatening to people until they feel like they've been, like they're cornered, or they don't know why something is happening. And so there's reasons behind that, and we'll talk about those shortly. I think, let's see, let me start the next
slide. So
yeah,
the next
is a question. That's right.
What are some reasons that a person with dementia may exhibit challenging behaviors? I think you touched upon some of this, but what are some other reasons that you may see, or that we've all probably have seen?
Yeah, so here's the answer that I was giving you a minute on the next slide is unmet needs. So you think about your daily life and how well you're able to accommodate things that you need to make your day complete. So of course, there's always things about going to the bathroom. If you have a headache, you're going to take some Tylenol, or you're going to tell somebody, could you go get me some Tylenol? These are all types of things that you can run into. When you think about common triggers on this slide, there are points of like daily comfort issues that you can't address because we lack the ability to communicate that specific need. And I'll give you an example that I had a person that I worked with here. His name was Joe, and Joe, he could walk. He had a cane, but he wasn't really steady. So most of the time for longer distances, he would go in a wheelchair. But every once in a while, Joe would get up and start walking around. And of course, in any kind of like a facility or institution type setting, the first thing people do is to say, no, you better sit down, because we don't want him to fall. We sat there for a little while and we started to figure things out, and it turned out that the reason that Joe was doing this wandering behavior that was upsetting the staff so much was because he had to go to the bathroom. And so once we figured out that his problem was that he needed to go to the bathroom and couldn't tell us, we recognized that, and as soon as he would stand up, we would help him to the bathroom, and that solved that unmet need. But if you're hungry, this presentation will be shorter, but if you get into like a long meeting, or you're going to be antsy and fidgeting left and right in your chair because it's not always comfortable, so you're going to address that level of comfort. When you think about how much or how good we are on our best days, at least, in dealing with all of the input from our environment, it's actually very remarkable. We get distracted by sounds, and we have thoughts about, what the weather's going to be like tomorrow, or I have these bills I have to pay, and you have all these thoughts and actions going on. We do a pretty good job of handling that. But if you imagine someone doesn't have quite the cognitive capacity to handle all those things, very few activities can become overwhelming. So sitting in a restaurant, having, soup and salad at lunch with a crowded group, just that loud overstimulation that you can't block out and you can't rationally address becomes a reason for maybe an outburst. So that's something to really think about. As we age, it is harder for our bodies to regulate our temperatures. And I find it interesting how many more sweaters come out in the winter or in the summer than in the winter, because it's 95 degrees outside, but we have the AC pumping inside. And so someone who can't quite regulate their temperature very well comes in and they're cold. And so that could upset them. They're hot, and so they might become irritated. So not being able to regulate that temperature. I think our PACE center, I think the government Medicaid requires us to be, I think it was between like 72 and 86 degrees. And if we're outside of that window, we're in trouble. And so we do pay attention to that. We get the facility staff to come in and adjust our temperature so that we stay in the right zone, because we don't want someone too cold because they're sitting in front of the register and the AC is blowing on them, because then they're going to be upset. We want them too hot, like we were outside doing an activity and they became overwhelmed. So that's an issue. I didn't put any slides in about communication, but that's kind of the root of a lot of these issues, in that the inability to communicate that need. So pain is a big issue, and there is physical pain. You stub your toe on something, or you get injured, and so that hurts. But perceived pain is also pain. So if you're uncomfortable because your chair isn't quite right and you feel like you're in pain, but you can't ask for any way to either reposition, or can I have some Tylenol, or that kind of thing, or it really can escalate. These little things, it's like the princess and the pea. We wouldn't think that we'd be affected that much, but it really does have a big impact on folks. My favorite really on this is thinking about that sometimes we're just cranky. I know I get cranky. There's, maybe stuff is overwhelming a little bit in life, or maybe I'm just in a bad mood. I got up on the wrong side of the bed. So that's always a possibility. So you got to kind of remember that one.
I think one of the things I remember from one of the classes I took too was it kind of ties into overstimulation, but over activities, like having them go from one activity to the next without allowing them a little rest period can sometimes trigger, I think, some of them behaviors that we see.
And sometimes even just giving options can become overwhelming. So if you think about how long it takes to process a question, if I ask you, you'll mull it over for a couple seconds and then you respond. But if you have a slower or a more difficult time comprehending language, so you won't quite understand what I'm saying, so it takes longer to process. Sometimes it takes up to, we have a 90-second rule. So it could take a minute and a half for someone that has significant dementia to really understand what you're saying. So if I say, Mom, are you hungry? She starts processing that. Might need a minute, but then immediately I fire off, are you cold? Are you in any pain? And I give her like 5 or 6 different things. That can immediately, just asking those questions can easily overwhelm someone. So definitely taking your time and limiting all of that outside external stimulation definitely will help. All right, we'll try the next one.
All right. So what are some tips we can give our caregivers that are with us today when behaviors do become an issue in caring for their loved one?
So that is the best part. We all know the things that we see that are difficult, but then you say, well, what do you do about them? So I'm a big fan, and you can look this up online. Thank you for the slide. Teepa Snow is the name of an occupational therapist, and she's a real big name in the world of working with folks with dementia. I think Amy's got some knowledge of this. When we think about processing our environment, there's a lot of things that will affect that. But if we think about our senses, this is how we interpret the world, right? We look at things. If a loud sound goes off somewhere, we hear, but we immediately turn our head and look to it. And so if those senses are diminished in some way, because hearing does change over time, our visual field with dementia does tend to decrease from a wide peripheral vision to a more narrow vision field, we can easily start off an interaction in a very bad way. Frequently at work, if I go to see someone and they need to have their foot put up on a leg rest, I do it too. Like, I just reach out and grab their foot. That's not the worst thing I can do, but if we think about when someone's in a bathing or toileting kind of situation and I walked up and I started to fiddle with their button and zippers, that can be really overwhelming. But if I use this approach, and Tipo Snow calls it the positive approach to care, you always want the person to have their have you in their visual field first. So I wouldn't yell, "Hey Bob," and like try and startle him. I would get in front of him so that he could see me. And if he's sitting down, I'd want to crouch down lower or maybe get down on a knee so he can see me. And that right there already starts to kind of soften this interaction. And then the next thing, so that's seeing. The next thing I do is hearing, and I'll say, "Hey Bob, how you doing? We're gonna go to the bathroom." And so those two things there really start off the way to interact. Because if you start off wrong, you can forget getting your job done or whatever you're trying to do. But if you start off proper, then you have a better chance of both parties involved accomplishing whatever they need to do and feeling good about it and feeling independent and positive. We always so we like deep pressure. So if you're helping someone and you're holding hands, like a nice, not squeezing hard like you're going to break their knuckles, but a nice firm grip is good, as opposed to like light touch. Light touch can be tickly and unnerving. So if we're going to help somebody out of a chair and we're going to use it, we want to have a nice firm grip there. When we interact with folks, another trigger point is kind of perceived dominance. So I'm a tall person, I'm 6'3", and so if I go and I talk to this lady, everybody called her grandma, she was one of our participants years ago, and she was probably, I don't know, 4'10", and so if I stand in front of her face to face, then I can be perceived as very confrontational, but if I introduce myself, "Hey grandma, how are you doing?" and then I step to the side, that side by side is kind of more of a joint attention activity. It's more of a supportive activity, and I can also help. There's certain things I can do, but there are ways I can help kind of guide her around if I need to help her walk in a direction or not. It's much better to, again, start with the positive and don't start negative. The positive also. And I haven't seen this too much with families, but sometimes family caregivers get a little burnout too. And so we might go up and notice that somebody has spilled some food on their shirt. And they're like, "Oh, geez, Bob, that's terrible. I got to do the laundry again." And I'm already starting off this interaction with very negative language. And that, not only the negative language, but the tone of voice, the facial expressions, that's all perceived behavioral language that can then cause someone to get agitated or defensive. But if I came out and I said, like, "Bob, I'm glad you enjoyed that lunch so much. I found a new shirt that we have that I think would look really good on you. Do you want to try and just put this one on?" So I'm not telling him what to do. I'm being positive. I'm allowing him some autonomy to some extent, but I'm also supporting him and then also accomplishing the job of getting a clean shirt on. So if that makes a little bit of sense there, that's a very effective technique. And finally, for this slide, working with people, no one wants to feel dumb or incapable of doing things. So my son and I were working on his car last night. We had to take the oil pan off to do some repairs, and we've never done this before. So of course we went to YouTube and we're doing all this work. We worked on that thing for like an hour and a half and could not get it to budge. And we were super frustrated because we were essentially failing at this task. And so no one likes it. That was just an example of like an everyday type thing for me that really upset me and made me feel kind of dumb. But if I had someone there that was going to help and support me and not just take over and come in and say, "Hey, give me that job, I'm going to do this," and then push me out of the way. If I had someone there that was going to support me on that and kind of talk me through the process, I would finish the job feeling good about myself. I wouldn't feel kind of stupid. I'd feel that sense of pride of accomplishing a task. And that's what working with someone allows that to happen. So you might have someone who needs, like, say you're doing the dishes. Well, I could probably get the dishes done a lot faster than grandma could, and they'd probably be cleaner. But then she's just sitting over here on her own. So if I can invite her, maybe she can't really wash the dishes, but maybe she's good at drying them. I can invite her into an activity that we can work together on, and I can support her, and then we give her that feeling of pride. Because even when you don't have great memory, you do have an emotional response to life. All right. Some of the other things, there's a slide. Did I skip one? Oh yeah, I did skip one. Let's see. Do I want to do that first, or yeah, we'll do. Okay, yeah. So we'll stick with the slide. As a caregiver, we have to understand how someone living with dementia perceives the world. I was talking to a coworker the other day, and she's a physical therapist, and we were talking about how she was doing certain intervention with someone, and it was so simple for her. And I said, but don't you realize, like, that you know that so well that you think that's common knowledge? You know, you're a professional, you've been doing it for years, you expect everyone else to know, but you don't realize how intricate certain activities are. So even when you think about talking, if I'm going to answer a question to you, I have to be able to, first of all, hear, comprehend, and understand what you asked. Then I have to formulate my thought, which is pretty hard to keep that in my mind. Then I have to send it through all my neurons so that I can program muscle movements, I can work my voice in, I can enunciate, and I can articulate certain sounds. So that's really complicated. So if we don't actually have good expectations of what someone's capable of doing, then we're not going to have a really good interaction. So this might come up, I think, in a minute too, but a good example of a realistic expectation is, so my wife loves doing these 1,000-piece jigsaw puzzles. Really big puzzles, and they don't usually have shapes. They're hues, different colors, and it's really irritating because they're so difficult. But she's good at that. But if I imagine that she's got like a mild cognitive impairment or maybe a little dementia, like the mild dementia coming in, expecting her to do a 1,000-piece puzzle without getting upset is the wrong thing to do. Just like it says here, I can identify what she still likes puzzles, but maybe we drop it down to a 500-piece puzzle. And maybe we have them, there is a bunch of houses on it, so there's at least some pictures in there that we can, we're grading this activity a little bit, understanding that she doesn't have the cognitive capacity to pull it off. She does right now. I don't want to get in trouble with my wife for saying that she can't do that, but so I referenced Montessori style activities earlier. It's exhausting as a caregiver to be on top of someone all day long and finding things that they may or may not be interested in doing. But if there are things that they're interested in doing, and I think we're going to talk in a minute about how to kind of figure some of those things out, but to have those things around. So maybe somebody has always been a crocheter. So next to their favorite chair, they've got their needles and their yarn. Maybe they like cards. So over on the dining room table, you've got a deck of cards out. So when they walk by, it might trigger an activity that they can engage in, enjoy, perform, and then you can also either put your feet up or join them or get some have-to tasks done. We'll talk about this can-do jar in a minute, but when other people come by and they don't really know what to do, they're like, oh gosh, I haven't been around Grandpa for a long time. I don't know how to really interact with him. Having a list of activities or things set up that someone, like, I can participate with, my grandfather, without having to come up with my own, like, reinvent the wheel again. Understanding that the environment really does impact how people behave. We talked a lot about how like overwhelming sounds, very busy activities, very bright activity, or very bright areas. We want to have a good middle ground between bright lights. Like, these neon lights aren't great, but they're good for my office, but they're not good for like a social and calm interacting because they're too bright and they're alarming. They can reflect off other things that impact our vision. So really taking into consideration the things around. And we'll talk more in a minute about a routine, but routines are wonderful things to have, with knowing the fact that the routine often can supplant a memory. And I'll talk to you more about that in a minute. So the next slide, this is a little kind of freebie. If you need ideas, and I don't know why, I'm not good with formatting these things, so it didn't come out quite right, but or at least on this screen over here it didn't. But if you look at, these are some ideas of things that people can do. We don't want to focus on specific memories. Like, remember when we were at the beach 2 years ago and Johnny did this, and something very specific, because that's kind of difficult or very difficult. We want to focus on more of a fund of knowledge. So we might have a book, even a magazine about gardening. And then we can look together at it and say, oh, these, remember when we first put that mulch down and it had that smell to me, these things that people just kind of inherently know, and not the date that something happened. But you can do these different activities. A lot of times people do very well with sorting, and not to be sexist, but a lot of times the ladies that I work with, they've been folding laundry their whole life, and it is an activity that they're still good at. So I'm not trying to demean them in any way, but it's something that they might bring, gear themselves towards. There's a lot of tinkering, fiddling kinds of activities that you can use. Men are very hard to engage in activities, I've found. Sometimes you get lucky because they were a mechanic and they like to fiddle with nuts and bolts, but you can have those out. The crossword puzzles or all those kinds of little word find puzzles are great to have set up around the house, and just remember to grade them properly. So your loved one might do the Sunday crossword puzzle now, but in the future maybe they can only really handle a Monday. You got to simplify things just a little bit. Having pictures up around it for family is great, because it gives you that sense of self and inclusion in a group if you're seeing those things, because you still have a little bit of that emotional memory. Again, no specifics here's a picture of, do you remember who's this? Who's this person? Quizzing people never helps. But if you have the picture out and you say, wow, they were having fun at the beach that day. And then, of course, exercise. We like to put exercise, not a formal exercise where you're on the treadmill or on a bike all the time, but we include exercise in all the activities that we do throughout the day. So getting up and walking to the bathroom is is exercise. Going for a walk around the block, if you can do it that much. Standing in the kitchen and drying plates and things, that's a lot of different weight shifting activities. So those are things that are really good. So use some of these as a good clue, or is a good source for some activities that you might want to include. And then I think we'll do, this is the last one, the routines. If you think about the things that you do in your life, you have routines. You have, get up in the morning routines. You think about even when you shower, there's a place that you probably start with the soap. I know it's always for some reason, upper left shoulder, And so if somebody tried to get me to start my shower by washing my foot, I couldn't take over because I would be so confused. But think about all those routines. And when someone develops a routine, there's this concept called failure-free activities, where you make things hard enough that they're doable, but not so hard that they're frustrating. And in that, the idea is that there's a familiarity with activities that develops over time. And I don't have time to tell you enough about this, but we had a real big success here at Pace, working with someone who was very agitated and manic when she started, but through time working on this, developing a routine daily, she eventually got within a couple of months to where she was sleeping at home, and the family was then able to sleep, and she was eating better. And so using this routine is really great. It helps you maintain your sleep-wake cycle. Oh, you can do the next slide, I'm sorry. Sleep-wake cycle, you get better at appreciating and knowing and operating through a meal. So if you get up in the morning and you shower and then you have breakfast, that's more of a natural routine. The problem with the routine is that if you have a really good one and you know the environment and you know the activities, and you don't have to be rigid, but you're pretty well sticking to the case, disruption of the routine over, we had some of this happen. So this lady was living in her own apartment. She was getting close to not being able to be safe there, but her family was going out of town. They provided a lot of care. She was in a assisted living for 2 weeks. And in that 2 weeks, she was taken outside of her routine. And when she went home, she could not handle a single thing. So her routine was disrupted and she couldn't pick up where she left off. Now, we might have been able to force it, but there were some safety issues at night, so we couldn't pull that off. But thinking about, if you have that great routine, maintain it. But if you're going to go on vacation, don't go away to the beach for 2 weeks. Maybe do an extended, maybe do 5 days, because when you come back, you want to be able to fit back into that life. All right. I know I'm going a little long, so.
Yeah, I think the next question is, as caregivers, should we involve our healthcare team in regarding these behaviors?
So yeah, this one is a easy one. The next slide answer is of course yes. There's times where you might notice that somebody, they're a little sleepier today. You're not going to run off and call your doctor because they're a little sleepier today. But there are things that can have happened. So, did they just start a new medicine? Like, were you at the doctor, they changed a dosage on the medication, and that's causing a change in behaviors or change in arousal? You definitely want to let the team know. It could be because these are progressive diseases, so they get worse over time, some in different manners, some faster, some slower, but there are always conversations about what you can do. There might not, and there's no miracle drug that fixes things, but you can always have conversations and help to make sure that the caregiver, you as the caregiver, feel like you understand as much as you can about the situation. And then also, is there an acute issue? I was going through my mind, should I bring this up or not? Most of the time when people have a change in behavior, at least in like facilities, everybody says, oh, they have a UTI, like a urinary tract infection. That's like the low-hanging fruit because it's a fixable thing. But you also have to make sure that you look at objective reasons why you think that a change in behavior doesn't mean that that's the case. Change in the behavior with frequent urination and burning on urination and, those kinds of, there are things that you can add up, but there could be an acute issue. There could be, somnolence could be, maybe they're developing like a little pneumonia or something. There could be something. So please, definitely don't be afraid to call your doctor's office or your, if you have a case manager or any kind of care coordinator. Keep everybody, because it's a team approach is what we really need to do.
No, I agree. That's important.
Yeah.
I think this is a two-way question. So one is, should we consider medications and maybe how they impact behaviors first? And then the other one is, should we talk about using meds to help with the behaviors? So I'll give you this one and then we can chat the other one.
Okay. Yeah. So this, the first thing I thought about this was, well, yes, we should always consider medications in that, like I said before, was there a recent change or are they on too many medications? Like I wouldn't immediately say like, whoa, they're like when somebody has any kind of negative behavior or outburst, a lot of times people say, well, we need to give them some more like some kind of sedating medication. Well, that's going to increase the risk for falls and that's going to decrease their quality of life. That's going to do so many things. So if we don't, and the medicines aren't really that good. They accomplish some tasks, but they always take away maybe more than the benefit that they provide. So yes, think about them. But if it is a change in behavior and you think, well, why is she always doing this? Well, we have to do like kind of a root cause analysis. Start thinking about the environmental factors and then the social factors and things that are going on in the home. So we look at this next part is just non-pharmacological interventions, and these are a lot of the things that I alluded to beforehand. So making sure someone is able to stay meaningfully engaged in an activity that they are enjoying will definitely help decrease, negative behaviors. If you stay interactive, if you're still, and there's a slide about socialization, it provides more of a calming sense. Again, we focus. There's not as much like objective and logical thought process, but there is an emotional thought process, and being included in a group is very soothing. When you stay engaged and you're walking around for some exercise, like you maintain your skills longer than maybe if you were just to be quiet in the corner. We always talk about decreasing fall risk, so staying limber and making sure you eat well so that your skin is in good condition and your bones are still strong. So make sure we do all that. And so all of these benefits really, hopefully, reduce the need for any kind of medications. Now, there are times where they're beneficial, but you talk to your healthcare team and your family and find out like all the nitty-gritty stuff about it and make a good informed decision because you get to ask all these questions. I'll let you take a look at this. As I already talked about choosing the right on the next slide, choosing the right activity. This is like part of the benefit of staying engaged. But we talked about this a little bit, and you can read this pretty easily. Something that I do like is the socialization. A lot of times, families on the next slide, families will kind of pull away from their social groups because it's awkward. Other people don't know how to interact around someone living with dementia. And so, but you can still get out in the world. You know, there's a lot of restaurants that have, I know in different places, they'll have a different, like a logo, like a purple something on the window, and you know, it's kind of a dementia friendly restaurant. We see it, well, I won't go into that yet, but that way you might go to dinner a little bit earlier where it's quieter and the people know better how to offer you choices that are overwhelming. Take your time between activities. So you might see family, but when you're having Thanksgiving and 50 people come over, don't put grandma with 50 people. She can be somewhere and people can come in and say hi and keep it calm, and she can enjoy that. So just make sure that we set up opportunities that they can still enjoy socialization. And I think that that's the last slide.
I think you're right. I think great tips. I
Thank you.
appreciate all the input, and certainly I love that you referenced Teepa Snow. I think she has a lot of great YouTubes that people can access to look at some of the suggestions that you made. I think so important. I will send Wendy too. I don't know if everyone's familiar with Joe Huey's 10 Absolutes in Communications, but she also gives tips about communicating and helping to avoid then, escalating behaviors, which I think is helpful. We can post that on the website as well, Wendy, to give some tips. Are there any questions from the audience? I'm not sure that I've seen anything in the chat. Does anybody have a question? You're welcome to unmute if we can, or do you have something you'd like to share? I'm going to tell you one thing. I did have a caregiver program once, and I brought little fidget things. One of them was I cut up PVC. Well, my husband cut up PVC piping and the screw part too as well. But we had a gentleman who came with his daughter who had some cognitive impairment. She was worried he would get agitated during the 1 hour session. And we gave him the PVC piping because he used to do like construction work. He sat the whole time putting the PVC pipings together. It was the perfect match, as you mentioned, Kevin, to find that like go-to activity that they can relate to, which really worked out well. So much so I gave her the little bag of them to take home with her to use. So,
Nice.
Again, I think finding that is so helpful.
Yeah.
The other point you brought up is I had a patient at one point who was in assisted living who was doing so well, and then all of a sudden her behaviors escalated. Well, come to find out, her nursing assistant was off that week that knew her, that knew how to engage her. And that made all the difference. So that then we started kind of a communication board so that people would know her routine and things she'd like to do during the day, that then if someone was away that knew her, it didn't cause such disruption.
Yeah, those are great ideas.
Anyone else have a comment or want to share anything they have found helpful?
Hi, this is Ramona, and I was trying to do the chat, but the chat is disabled. So,
Well, go ahead. Tell us. Do you have a comment, Ramona, or do you want to ask?
this has been very helpful. I'm grateful for the program that you guys are putting on every month. And I do have a question that is powerful tools for caregivers and the Savvy Caregivers workshops. Do we know when those might be available? Because I'm desperate for information.
You can actually take a look at our website. We just ended a powerful tools class and just started a savvy workshop. So we will have some additional building better caregivers and powerful tools for caregivers classes coming up over the next couple of months.
Thank you. I've been monitoring the website and I'm not seeing them on there as being basically something that I can sign up for, or maybe I've just missed it. Thank you. I'll keep an eye.
Yeah, and Ramona, also the Alzheimer's Association has their caregiver support links too. If there's one in your area, you may want to look at that. I don't know if you follow their website as well, for the Greater Maryland chapter, or if you're in the lower southern part towards DC, the National Capital Alzheimer's Association is another site. And then you're welcome to email me if there's further information I can provide. Let me put my email in here. Happy to send you some things. And there's my email as well.
Okay.
And I just added to the chat the link for the virtual workshops that are offered statewide. So you just keep an eye on those, and they should have dates upcoming for some new workshops. We kind of slow down a little bit at the end of the summer just because of folks going on vacations and not, but I know we'll have some active listings for September as well.
Thank you very much.
You're welcome.
Well, if there's no other comments or questions, then we'll thank Kevin very much for this helpful session. We look forward to having you back. Maybe you can talk a little bit about some of the work that you do with speech and things. So watch out. You're on our list now.
All right. I appreciate it. I look forward to it.
Next month, we're going to talk, as Wendy said, about urinary incontinence and bowel elimination. And guess who your speaker is, but none other than me. So watch out. So we look forward to talking a little bit about that. And if there's other topics that you're interested in, please feel free to let us know. We're looking to expand the program. We're going to line up some other speakers in regards to topics you have sent in. So stay tuned, but we're excited to continue with our monthly chat. So thank everyone for joining us. Thank you again, Kevin, for presenting. And I wish everybody a cool next month. How's that? If you're in Baltimore, we know
We'll
that it's
take
really
that.
hot. But
Thank you all for joining us. Thank you
Thank
again,
you.
Kevin. And this will
Thanks
be
again.
recorded and posted on our website for your use and as well as the PowerPoint slide. Thanks.
Thank you.
Bye.
Thank you.